Hi, Reza. How's it going?
Hi, how are you, Jane?
Good, good. So, how's your week been?
My week was a kind of slow, but guess
Yeah.
what? I saw
What?
cherry blossom in Vancouver
Oh, no
last
way.
week.
Cherry blossoms. I think we were just talking about cherry blossoms, but maybe it was not that long ago.
Yeah.
Oh, funny. We don't get too many cherry blossoms here in Haida Gwaii, but that's okay.
Okay. How was your
The
week?
temp Oh, it was good. On Saturday night, got together with a couple of friends and made cookies, Christmas cookies. So now I'm trying my best not to eat them all.
Nice.
Shortbread and macaroons so yeah, it was quite fun. Quite fun.
Awesome.
Yeah. So as you know, we are reading the a book called Hypnotherapy by Dave Elman. Here it is.
Mhm.
Can you read it, Reza? Because if you can read it, everyone else can.
Yeah.
All right, there we go. So that's the book we're reading. And
Yeah.
it's a textbook. It's a book that used to be called The Findings in Hypnosis. And it was written by a fellow called Dave Elman back in the 60s, in 64. And he wrote it in response to all the medical men that he was in contact with and that he trained in hypnosis over the years. So I had a chance to read this about 8 or 9 years ago, and I don't even think I remember much about it when I first took my hypnotherapy course. But I started to read it again a few weeks ago, and it's like full of information.
Yeah.
So I've asked you, Reza, of course, to go through the book with me so we can actually chat about it.
Yeah, absolutely. I'm more than happy.
Yeah. So we were going to go just through a chapter or two or three each week. Some of the chapters are really short.
Mhm.
But this week we went through essentially the introduction and chapter one.
Yeah.
So we're just going to be chatting about what our thoughts were about the book. And if you hear this at a later date, you can send us questions or comments, and we can chat about them in the next book club. So, so one of the things in the introduction that, well, we chatted about this last week as well, but
Yeah.
uh, hypnosis is something that you, Reza, have been practicing with your clients for many years. And how did the introduction for you, just talking about how Dave got into hypnotherapy and, well, I guess it's hypnosis. So how he got into it is by accident. And I think sometimes that's how most of us find out about hypnosis and hypnotherapy. How did you get into the whole hypnosis scene?
Yeah. I think when I was graduated from medical school, I went to Australia and I met a psychiatrist using hypnosis in his practice. And that was my first touch. And then I came back home and I started learning about hypnosis. I used to be a family physician, so I started applying hypnotherapy in my practice. And it took me 15 years to
Wow.
where I am right now. Yeah. And that was a great journey. And it's just a
Wow.
start, just the beginning.
I totally get it. It's like Dave Elman says, it's like we have the fever.
Yeah.
and and you just there's so much to know about hypnosis. It seems pretty black and white on paper, or when you first hear about it. At least that's what I thought. But
Yeah.
there's so many different areas to study and so many different techniques, and it's all in the subtleties of how you go about it that
Yeah.
makes it really effective.
Yeah,
And you've
absolutely.
had lots of practice.
Yeah, and for sure we are focusing on medical aspect of hypnosis and hypnotherapy. But the beauty of
Exactly.
hypnosis is it is so multidimensional. One end is in medicine, one end is in philosophy, one end in literature and linguistics and semantics. So that's the beauty of hypnosis.
Right, right. And when I was reading about hypnosis, at least this time around, I really got into the, like you said, the semantics and just the different. What I love about Dave Elman is he was teaching medical men all those years, and I, like you, having a medical background, really saw the value in hypnosis as opposed to what hypnosis to some people has become, and more of the stage hypnosis. And that is something that you and I, Reza, are really trying to educate the public about, the value of medical hypnosis. And as you call it, evidence-based approaches to medical hypnosis. And also just how many uses it has for us. So when I was asking you a couple of days ago just about the different things that were really important about hypnosis and consent. And because a lot of us think about hypnosis as being something that we can, that someone can take advantage of us. And I know you explain it really well about how we need consent, and we can't be made to do something that we don't want to do.
Yeah, absolutely. It's a very crucial part of hypnosis. And when we say consent about being hypnotized, it's not just because of ethical considerations or liability purposes. It is also a part of the process of being hypnotized. So without consent, nobody gets hypnotized.
Right. And even when we're in hypnosis, we can't be made to do something we wouldn't normally do.
Yeah, absolutely.
In spite of what people might think.
Yeah, that's one of the misunderstanding around hypnosis, that the hypnotist or hypnotherapist has a power. But I like the way Dave Elman positioned that. He says there is no such thing as hypnotist. And
right. Yeah.
He calls hypnotists or hypnotherapists as operators or facilitators during the process.
Yeah, that is pretty cool.
Yeah.
Of course, what does that make us? Operators. I don't know.
That's the truth. We are just operators, and our role is so minimal. Let's face it.
Yeah, yeah. So he was saying that the three things are consent of the person being hypnotized, or allowing hypnosis, or well, we'll get into the semantics of that. The communication between the operator and the subject, and then freedom from fear. In other words, really understanding what hypnosis can do for us, and also what hypnosis isn't capable of doing, and that's making us do something that we don't want to do. And he was also saying that when someone is in hypnosis and we do suggest something that they don't want to do, they either can not do it or they come out of hypnosis.
Yeah.
So it's it terminates hypnosis. So yeah, fascinating.
Yeah.
So what was this other? Okay, so we're going into chapter 1 here. There was something that So, and another thing that I found quite fascinating, in chapter 1, he says, I am not a doctor. And yet he trained thousands of dentists and doctors and psychiatrists over the years on how to use hypnosis. And he got into it as we chatted about, because his dad was quite sick, and a stage hypnotist came to visit one day and was able to remove the pain that he was experiencing for the first time in a long time, so that Dave, being a young boy at 8 years old, could play with his dad.
Yeah.
And that sat with him, and he thought that was amazing. And so he learned a lot about hypnosis because of that, but got out of it because he was able to hypnotize everybody, he said, with the handshake.
Yeah.
Or at least that was one of the methods, which will go later in the chapters. But then apparently one of the young ladies he was dating, her dad was upset that he was dating her, and so he decided he couldn't continue dating, so had to stop hypnosis. Anyway, so then he got back into it years later. Anyway, that's an aside. So the levels of hypnosis. There's the levels hypnosis, or the different types of hypnosis. Did we make notes on that? Where are my notes on that?
I think Dave Elman's introduces a higher level of trance, and he calls it hypnosleep. So everybody knows that the deepest level of trance is somnambulism, which we know that as the highest depth of trance. But Dave Elman introduces a higher level of trance, and he calls it hypnosleep.
Right.
So, yeah, that's really interesting. And that's
because he said, Elman's. Oh, sorry, go ahead.
Yeah, and that's unique to Elman's.
Right. So I find it fascinating that if someone, explain this to me. So I'm going to be asking you questions along the way. Yeah, I remember him saying, you can't, people won't fall asleep while in hypnosis, but people will be able to be put into hypnosis while sleeping. Right? I think that's how he described it. And that's because the contact with the operator doesn't remain if someone actually falls asleep. They're just going to fall asleep.
Yeah.
Whereas if someone is asleep, then that is what hypnosleep is. So he can hypnotize, take you into hypnosis while you're sleeping. Is that right?
Yeah, my understanding is the difference between sleeping and hypnosleep is the subject is receptive and responsive to suggestions in hypnosleep. But if the subject is sleeping, he or she doesn't respond to suggestions. And it happens a lot in hypnosis. Sometimes you are thinking, is the subject really sleeping or he's in deep trance? So the only way to try it, to test it, is just to make a suggestions. Like, now you open your eyes slowly, or now you just start laughing. What I really like is try by you. Now you start smiling. And if I see the smile, I realize that, he or she is not.
They're listening.
Yeah.
Okay. Oh, that's good. That's a great way to test.
Yeah.
Oh.
Yeah. What I really like about chapter 1 is hint about intraoperative awakening. Awaking. So getting awake in the middle of operation.
Right.
That's a really interesting topic. And what interests me is he's talking about that in 1980, or what is the date of publishing this book? You mentioned that.
64. In 1964. Yeah.
And you know what it is?
So 1964.
It's really something like 30 to 40 years earlier than other physicians to focus on this, because I know there is a movie around intraoperative awakening called Awake, and that movie was out in 2007, and Larry King had an interview with physicians in 2007 about it. But imagine years later, after Dave Elman brought up the conversation around this phenomenon, intraoperative awakening, right?
Right, which of course is because what happened was he was able to interview physicians or surgeons who performed an operation and the patients who had the operation performed on them. And the patients were able to, in what's called Esdale state, which is I think it's called a coma or Esdale state, which is below somnambulism. And he was able to, you can correct me on some of these, but I think I remember that. But they were able to recall what happened to themselves while they were anesthetized in an operating room having surgery.
Yeah.
But they weren't able to recall it consciously. They were only able to recall it in hypnosis because they just had a feeling, or there was something that they were experiencing in response to the conversations that the physicians were having during the surgery. And he was so surprised that he studied it himself and for years and spoke to many, many people. And there was continued evidence that people can hear while unconsciously while they are anesthetized. Can you imagine?
Yeah, he is such a pioneer.
Oh, totally.
Yeah.
And one of the comments that he makes, he also says that, is there any possibility that a person who is made unconscious by an accident or any other means still retains a sense of hearing, and that the victim's mind is still working through the consciousness, though the consciousness is below the level of awareness? And he says, I believe further research has indicated.
Yeah.
So
very important question.
Yeah.
Yeah. There is a huge possibility that they keep all the incidents in their unconscious mind and then they forget. And maybe that's the cause of a lot of PTSD or post-traumatic stress diseases after the incident.
Right. Because you have the experience of it below conscious level and not aware that it has affected you so deeply.
Yeah. So one interesting thing, when you just search for intraoperative awakening, you see the incident is really rare. So anesthesiologists say that it is 1 to 100,000 or 1 in 2,000 patients. But they don't measure the unconscious content or unconscious part of the game. So Dave Elman says it is very common, but anesthesiologists say it is uncommon and it is rare. The discrepancy is between the conscious part and the unconscious part of retaining the information.
Yes. Oh, definitely. It's really actually quite, I don't know, but what's interesting is that the hypnosis in general, as you and I were chatting about, is now out of fashion and quickly became, so to speak, out of fashion and more of a, I don't know, something that people did only for fun or and the reason why is because anesthetics and drugs were certainly more predictable and reliable as far as anesthetizing patients shortly after this book was written.
Yeah.
And so in the late 60s, early 70s, all of a sudden there were a lot more options available to anesthetize patients during procedures and surgeries. And that is why hypnosis is no longer, well, it's a big reason why hypnosis is no longer used. I know that working in the dental field, many dentists have taken a course in hypnosis, and it probably wasn't a very long course at all, but they haven't used it much since they graduated. In fact, it's just a course they take and then they've never continued on with it.
Yeah.
And now you were talking about, this is definitely an aside, but you were talking about a conversation that you had with physicians, or at least participated in, as to why physicians are now looking for other alternatives to pain medications.
Yeah. I was actually, I attended a seminar about substance use and chronic pain, and the interaction between chronic pain and substance dependency. And physicians were very open to have a conversation around the role of hypnosis for chronic pain, because they are facing a real crisis, a real opioid crisis, particularly in BC and Vancouver area.
Right.
So yeah, I think hypnosis is a great solution for chronic pain issue and opioid crisis in our community.
Yeah, well, it's definitely, I think there's, I mean, you and I both know there's so many potential uses for it. I don't think most people have even considered it for an option, but once more and more people hear about how effective it can be, I don't know. I think for some reason, some people, it has to be the last resort because it's not on their mind. But when with this opioid crisis, as you mentioned, it's definitely needs to be one of the options that are available for patients who, well, the physicians who don't have any other options for people who are in pain, chronic pain, especially.
Absolutely.
Yeah. Huh. So many uses.
Absolutely. I hope one day soon physicians join us in this book club and the journal club we run, and share our experience about the applications of hypnosis in chronic pain. Because it is evidence-based, and as you mentioned, our benchmark for hypnotherapy is evidence-based medicine.
Yes. Yeah. The one of the interesting things back to the book was what Dave Elman and his wife Pauline did was Dave taught, as he calls them, medical men and dentists and psychiatrists, but his wife participated in the background transcribing every word that was said in these classes during the sessions. When they brought the physicians and medical men into the front of the classroom, I have this image of him bringing each of them at different points to the front to show a technique and practice a technique. But every word was transcribed in those classes. And to have this resource to learn from again, and it being the only resource really that's available to everybody, is pretty amazing.
Yeah.
So he has a few cases here that he was talking about. Of course, what was one was the one of the important findings, patients hearing during a general anesthesia, but another one was the use hypnosis in patients with impotence.
Yeah, that's really interesting.
It was, and the most interesting part was how effective, and this of course they say it's an old terminology, impotence and frigidity. Isn't that exciting? So those words are not so much used anymore, but treatment of sexual disorders and issues. And he found that most of the time he could help these patients with their issues, especially if they knew what the problem was, if it was psychological, or if they didn't, he would use a deeper level of hypnosis to discover the reason, which may or may not be related. But so it was quite fascinating that he reproduced the results and was able to have amazing results.
Yeah. So he mentions sorry, go ahead.
Yeah, and he was saying how he has very incredible results with men, but not as much with women, but certainly more than he ever expected, because of course he said that possibly women would find it more difficult to reveal their concerns even in hypnosis because of their being only able to do this with other women. So what did you think about that?
I like the part of hypnoanalysis part, because David Elman says in some cases it was very straightforward and the cases remembered the triggering incident. So it was very easy to handle the situation of sexual dysfunction. But in some cases, the physicians were not successful to find the triggering incident. And he suggested the use of hypnoanalysis, which is a kind of psychoanalysis under hypnosis, to find the cause of or triggering point of the incident. So I like the idea of hypnoanalysis, because hypnoanalysis is one of the areas that is very interesting. And and he says 90% of sexual dysfunctions or impotence in his terminology has emotional causes, 90%. So 10% are attributable to physiologic or anatomical issues.
Is in medicine, obviously, you have to address any functional or other issue and make sure everything else is okay until you psychological issue.
Yeah, that's a great point. Despite the fact that 90% of the causes of sexual dysfunction are emotional causes are diagnosis of exclusion. What I mean by diagnosis of exclusion, I mean all the physiological and anatomical causes should be excluded by the specialist. Then we can label a problem as emotional related.
So, and then he goes on to say, so that essentially there's two types of pathology that where the pathology has been ruled out. After that, there's type A, where the patient knows the cause and therefore can be addressed in somnambulism, or where the patient doesn't know the cause and they have to go into hypnoanalysis. So And it says the public enthusiasm for medicine shows that such findings are also interesting to the layman. I shall therefore describe and document them. I find it fascinating that he's put all this together and the amount of work he put into the research as well. But to be for him to be a layman as well, as far as having no medical background and medical education, to be teaching physicians and psychiatrists for all those things, but they didn't have any other method of anesthetizing a patient. At least that's one big part of what they used hypnosis for.
Yeah. And to me, it's interesting.
So,
Milton
yeah.
Erickson was a psychiatrist, and he was
Mm-hmm.
teaching hypnosis to everyone. And Dave Elman was not a physician, and he was teaching hypnosis to physicians and psychiatrists. That's interesting to me.
Yeah. Well, and I remember reading about Erickson teaching it to everyone because he thought it was such a valuable tool that everyone needed to have it.
Yeah.
And I'm thinking Dave Elman didn't have enough time to teach everybody, but thought he saw the value in, how old was Erickson, or what generation? When was he? I don't even remember. I think he was probably, I don't know. I don't know how old he was compared to Dave Elman, because Dave Elman was born in 1900 and passed away in 67.
I'm under the impression that Milton Erickson was younger, very younger.
Right. Yes. Yeah. I'm thinking, we should know that. I can't Google it because I'm on my phone right now. Anyway, interesting thought.
Yeah. Something for Googling tonight.
Yeah, there you go. So, yeah. So, how much time do we have? Where are we at right now? So while you're looking that up, next week, we will be going into chapter 2, and it's called Why I Started Teaching Hypnosis. We might do a couple of chapters and then how to study hypnosis.
Great.
Yeah. So it should be a fun week. Well, like I said, every chapter in this book is pretty fascinating. It's hard to put it down, actually. I could probably,
Absolutely, yes.
It is. It's fascinating. So, it's how much time do we have left then?
To be honest, I think we run out of time.
Yes. Okay. All right. Okay, good. So it's been fun chatting with you, Reza.
Yeah.
From across the water.
Yeah.
And I look forward to catching with chapter 2 and 3. And of course, if anybody has any comments or questions or any thoughts about anything we chatted about, we'd love to hear back from you. So have
Awesome.
a great week.
Thank you for having me, Jane.
Okay. All right. We'll chat
Enjoy
soon.
reading
Bye.
the next chapter. Bye.
Yeah. Okay. Bye, Reza.